Please listen here. So in your syllabus, you have to study about one is respiratory disturbances, one is hypoxia, second is hypercapnia, then physiological effect of smoking and carbon monoxide poison. These are the topics which we are supposed to study. Now this is not a very difficult topic. Mainly deals with what are the common disorders or disturbances affecting our respiratory system. And one such problem is hypoxia. Hypo means low, oxia means oxygen. So hypoxia means the body is getting very low oxygen. That situation is known as. So here there is a definition. It's a condition where tissues are deprived. Deprived means not getting adequate oxygen, leading to impaired. Impaired means wrong or poor functioning of the tissue. That situation where tissues are not getting sufficient oxygen is known by the name hypoxia. It comes from the word low oxygen. And here you can see the three or four main reasons which lead to hypoxia. One is high altitude. For example, if we are living in a very plain area where our altitude will be very low. I think our altitude is only 50 meters. We are living at a plane of 50 meters above sea level. But if you go to Munnar area, the altitude is increasing to above 1000 meters. Now if you go to many plains in North India like eastern portion of India or Himalaya, there the average elevation may be about 3000 or 4000. So living there, if we go there and living there, we may feel a lot of difficulty because atmosphere will not be having sufficient amount of oxygen there. But people who are normally living there are used to it because their body is adapted to that low oxygen. But when we go there, we feel difficulty. So low oxygen pressure in the air leads to reduced oxygen availability. So people who are normally living in such high altitude, they have more number of RBC and higher amount of hemoglobin. So even if there is less oxygen, this higher number of RBC and higher amount of hemoglobin can adjust with the or adapt with the lower oxygen level in the atmosphere. Another problem is lung disease. There are two common lung disease. One is emphysema, and the second one is known by the name bronchitis. I will show you a picture of how emphysema will be appearing. In case of emphysema, so here you can see that this is the normal. See here you can see that this is how the normal lungs is working. This is how the normal lungs is there. There is alveoli, and inside alveoli we have a balloon-like cavity, and air will be reaching here, and there will be diffusion into the surrounding capillaries. So during emphysema, this air bladder or air sac will be malformed. Sometimes it will be containing a liquid. So the problem in the emphysema is that the structure of this alveoli become disorganized, so that it will not be able to. Here also you can see that it will not be able to allow the diffusion of oxygen and carbon dioxide. So that is what is happening in the case of this hypoxia, this emphysema. So most of the time emphysema is caused by cigarette smoking. Cigarette smoking is a major reason for emphysema. Then another is bronchitis. Bronchitis means especially chronic bronchitis. Here you can see that bronchitis. You can see in case of chronic bronchitis, here, this is another better picture. See, this is what is happening in case of chronic bronchitis. Normally, these tubes, these are the bronchus. This is the trachea, and this is the bronchus. This tube is known as the bronchus. This is and this is the bronchioles. And if you look at the diameter of that, this will be the size of this bronchus. So in a bronchitis, what happens is that there will be inflammation or swelling. This inner wall of this bronchus will be undergoing inflammation, or there will be swelling. As a result, the diameter of this cavity will be highly reduced. So through this opening, very little oxygen can come through. So that is what is happening in case of chronic bronchitis. So as a result, what happens is that people will not be getting enough amount of oxygen. Though there is sufficient amount of oxygen in the atmosphere, but they are breathing also properly. But because of this problem inside the tube, the bronchus tube, which is very narrow, the very little amount of oxygen will be finally reaching the alveoli or lungs. And this situation is known as a chronic Chronic means somewhat permanent. You might have heard about chronic bachelor, someone who is remaining unmarried for a very long time. So something that is happening in the body for several years, for a very long time, is known as a chronic bronchitis. There is some normal bronchitis which may be due to some infection. So once the infection is over, the bronchitis will be over. But in case of chronic bronchitis, situation is more or less permanent. And that situation is known as a chronic bronchitis. Now another is carbon monoxide poisoning. Now carbon monoxide poison, here we are not very much used to this carbon monoxide poisoning. But if you go to European countries, they are very much afraid of this carbon monoxide poisoning. The reason is that they will be using inside their room a room heater. You might have seen that, because without room heater, and in ancient time, and they are mostly using either fire. They will be having a fireplace or something. When they are burning this fire, a lot of carbon monoxide will be occurring in the room. And this carbon monoxide is a colorless gas. We cannot smell, and there is odorless also. There is no smell for it. So we cannot detect it. None of our human sense organs are capable of sensing the presence of carbon monoxide. Only with the help of certain equipment or meters we will be capable of sensing this carbon monoxide. The problem with the carbon monoxide is that if the carbon monoxide and oxygen are present, the hemoglobin will always bind with the carbon monoxide. So instead of binding or attaching with oxygen, our hemoglobin will be attaching with the carbon monoxide. Then what happens? Hemoglobin will not be carrying oxygen. Instead of oxygen, it will be carrying carbon monoxide. So, and as a result, what is happening is that the blood is not carrying oxygen. All the tissues in our body will be facing a deficiency or lack of oxygen. And that is what is the effect of carbon monoxide. And last one is the anemia. Anemia, sometimes when you go to doctor will say that you have anemia. Means RBC is low or hemoglobin is low. So hemoglobin is the main pigment that is carrying oxygen. If the amount of hemoglobin, normally it should be around 12 to 13 the milligram per deciliter per 100 ml. If it is less than 10 milligram per deciliter, then body may not be having sufficient amount of hemoglobin. Then doctor will say that you should have more iron containing tonic, or you should have more iron containing food items, so that hemoglobin will develop in your body. So problem with the anemia is that hemoglobin is low, so body may not be able to carry all the oxygen, and as a result of poor hemoglobin, So that is the situation in the case of these four different situations which are leading to hypoxia. So hypoxia means very low oxygen content. Now another situation, now we have to also see what are the effects of hypoxia. One is fatigue. Fatigue means extreme tiredness. That is the meaning of the word fatigue. Breathlessness. We are unable to get oxygen and we find breathing very difficult. Cyanosis. Cyanosis means the bluish coloration of blood is known as the blue skin, lips, etc. And that is mainly happening because of carbon monoxide poisoning. Then impaired brain function. Our brain is very sensitive. If there is a lack of oxygen for 5 minutes, most of our brain cells will die. So that is the problem with the brain function. Then potential organ damage. Our body is not capable of sustaining oxygen deficiency for several minutes. If it is for more than 10 or 15 minutes, most of the organs and cells will be dying. And prolonged hypoxia can result in coma. Coma, you know what is coma, unconsciousness, and death if untreated. So these are the effects of hypoxia. Then body's response. How body will be responding when there is a lack of oxygen. The first one is that there will be increased breathing rate. Since the body is sensing that the body is feeling that the body is not getting sufficient amount of oxygen, what the body will be normally doing is that increase the rate of breathing, try to breathe faster. So that is known as hyperventilation. Then increase the heart rate. Heart rate is another, body will be increasing the rate of heart beating. Then increased RBC production. So that more RBC means more cells capable of transporting oxygen. So that is the effective body's response. So these are the some mechanism by which body will be dealing with this hypoxia. Now another similar situation is hypercapnia. Now in case of hypercapnia, what is happening is that it's a condition of excessive carbon dioxide in the bloodstream, usually caused by inadequate respiration. Because you know that our body is taking oxygen and giving out carbon dioxide. Sometimes if our rate of breathing is not very proper, if our inspiration is okay but expiration is not taking place in the right way, we take oxygen into the body, but if our expiration or exhalation or breathing out is not working properly, carbon dioxide from our body will not be moving out. It will be staying inside the body. And that situation will lead to a situation known as excessive higher amount of carbon dioxide in our blood. And that situation is known as hypercapnia. Hyper means more. And usually caused by inadequate respiration or inadequate breathing out. So the causes of hypercapnia is hypoventilation. Hypo means low breathing rate. The breathing is very low, very shallow or slow breathing, often due to lung disease or COPD, chronic obstructive pulmonary disorder, that is known as COPD, or neuromuscular disorders. Due to some diseases, our lungs is not capable of breathing out the air properly. That is the problem in case of this hypoventilation. Then another case is obstructive sleep apnea, intermittent pauses in breathing during the sleep. Now normally in some people, what happens is that during the sleep, they will be passing through a stage in which they are not breathing out. So the breathing rate may be very slow. So as a result, carbon dioxide buildup will increase. So that is another, this is happening only in few individuals, not in every person. So that is known as obstructive sleep apnea. Then respiratory failure. Lungs cannot exchange gases effectively due to several, earlier I told you about emphysema. Then chronic bronch. All these can create a situation in which our lungs is incapable of doing the normal work in the right amount. So what will be happening in case of hypercapnia? First situation is the effects. We have to see how if it will be affecting your body. One symptoms include confusion. That is too much carbon dioxide in your blood leads to confusion. There will be headache, shortness of breath, and in severe cases, panic attack. You might have some people, they get panic and they will be very scared, and that situation is known as a panic attack. Seizure means some kind of paralysis, not paralysis, then loss of consciousness. So these are some of the major effects of this hypercapnia. And one problem with hypercapnia is that hypercapnia can lead to respiratory acidosis. What is hypercapnia? More carbon dioxide in the blood. Carbon dioxide, if there is higher carbon dioxide in the blood, what will happen is that carbon dioxide will combine with the water, forming carbonic acid. And this carbonic acid is an acid that will be reducing the pH of the blood or increasing the acidic nature of the blood. So more carbonic acid in the blood, more acid in the blood, and that situation is leading to acidic blood pH or acidosis. So that is a situation of, so that is a problem in case of this carbon dioxide buildup. Now how body will be responding? Body attempts to eliminate excess carbon dioxide by increasing the breathing rate and depth. So that is why it is happening, because of slow breathing. So what body will be trying to do is that body will be trying to increase the rate of breathing. That is the body's natural mechanism. If this compensatory mechanism fails, what happens is that there will be acid buildup in the blood, acidosis will be developing, blood pH will be dropping, and acid content of the blood will be increasing. So that is the problem in the hypercapnia. So in your syllabus, only hypoxia and hypercapnia is mentioned, and I will tell you also one more topic, that is asphyxia. This is not mentioned in your syllabus, but for your knowledge you can. So in case of asphyxia, the body is completely deprived of oxygen. So it is an extreme form of hypoxia. Hypoxia means low oxygen. Asphyxia means complete absence of oxygen and leading to suffocation, like physical blockage. Some object is entering your throat, then that is a physical blockage. Drowning, when we get into the water, this is what is happening. Water blocks the entry to blocks the air entry to the lungs. Strangulation, physical constriction of neck, that is happening. Then exposure to toxic gases. So these are the main problems of asphyxia. It is a very complete absence of oxygen, is known as A means absence. So asphyxia means life-threatening situation which body is completely deprived of oxygen, leading to suffocation. And here affects initial symptoms involve gasping for air, panic, cyanosis, then there will be unconsciousness, brain damage, seizure, and death if no oxygen supply is not restored. So this is what is known as asphyxia. Now another is carbon monoxide poisoning. So we have already told you what is a carbon monoxide, how it is affecting. So in case of carbon monoxide, it binds with the hemoglobin 240 times more strongly than oxygen. So if there is oxygen and carbon monoxide, hemoglobin will first bind with carbon monoxide, because its binding capacity, its attraction is 240 times more than the attraction of oxygen to the hemoglobin. So that is why carbon monoxide can create a problem for us, forming carboxyhemoglobin, which is significantly reduce the oxygen carrying capacity. So earlier I was telling you that this kind of room heaters are one of the primary causes of this carbon monoxide. So in European countries, most of the houses will be having a carbon monoxide sensor. If there is a higher buildup of carbon monoxide, it will give you an alarm. so that you can keep the windows open, doors open, so that some amount of carbon monoxide will. The problem is that we cannot sense it. There is no smell, no color, and we know in no way we will be able to detect its presence. So inhalation of carbon monoxide from faulty gas heater. Nowadays most of the houses will be having either electric, but still gas is also common. Electricity is very expensive. So in many places the people are using gas heaters, gas room heat, because this is a winter season. So here if it is, we still have a temperature about 25 or 27. But if we check the temperature in most of the European countries, it will be below 5 degree. In some places it will be below 0 degree. So without some warming apparatus, room heater, surviving there is very difficult. So they will have to use either electric heater or gas heater. Then, so inhalation of carbon monoxide from faulty gas heater and car exhaust from fumes, that is also another problem. Then house fire is another reason. Then improperly ventilated combustion. For example, if you are burning something and it is a closed room and there is no proper air circulation, carbon, for example, a fireplace, people who are staying there always, they will be inhaling a lot of carbon monoxide. So these are the situations which are leading to carbon monoxide. That industrial accident involving exposure to carbon monoxide. So these are some of the situations which lead to carbon monoxide. And we can see what are the physiological effects of carbon monoxide. The one is symptoms. First one is, if it is a mild level, it's a headache only. Then dizziness. Dizziness will be there. The person may feel unable to stand properly. Then nausea. Nausea in Malayalam we call okana. Then confusion. Then weakness and vision will be blurred. So these are some of the situations which are leading to the happening as a result of this carbon. Then unconsciousness, boredom. So these are the problems which are leading to produced as a result of carbon monoxide poisoning. Higher level of exposure can lead to seizure, heart arrhythmia, that is, heart is not working at the proper rate. The rhythm of the heart beating will be changed, that is arrhythmia. Respiratory failure will be there. We are not unable to breathe properly, and death will be happening due to low oxygen. So here you can see that all the hemoglobin is actually taking carbon monoxide instead of oxygen. So our tissues and cells will not be getting any oxygen for their working. So that is what is happening here. Now how we are treating carbon monoxide poisoning? Usually we go for removal of carbon by administration of 100% oxygen. Normally the oxygen that we are breathing is only 21% oxygen, 79% nitrogen. So that is the air, atmospheric air. But in a situation, what doctors are doing, that doctors give pure oxygen, 100% oxygen, and that has an ability to flush out the carbon monoxide from hemoglobin. So this is the technique they are using. In severe cases, hyperbaric oxygen therapy. There is a very big cylinder will be there, and person will be put inside the cylinder, and it will be pumped with pressurized oxygen, so that the oxygen will be entering into the body, entering into the lungs, and as a result of that, because of higher oxygen pressure, a lot of carbon monoxide will be flushed out from the hemoglobin. So that is also a technique for this removal of carbon monoxide. I will show you how this hyperbaric oxygen therapy is actually done. See this kind of chamber. See here you can see this is a hyperbaric oxygen chamber. The person will be kept inside this kind of chamber. See, this is a hyperbaric oxygen therapy chamber. So it's a cylinder like thing, and inside that they will be giving pure oxygen under higher pressure. So this is what is happening here.